Hello everyone, thank you for joining us today. This is Jimmy from Milesight Product Marketing Team. For our today's webinar, we will be looking at Milesight Smart Healthcare Strategy, C.A.R.E., which represents the environmental comfort, safety assurance, pharmaceutical regulation, and last but not least, energy efficiency. As for our agenda, we'll first look at the smart healthcare market, what are some potential market opportunities, and then we will zoom into our smart healthcare product strategy. What does each pillar stand for in real life? And under the C.A.R.E. framework, what are some products of Milesight to be utilized under what smart healthcare related scenarios to deliver what benefits? And last but not least, we'll look at some successful stories of deploying our Milesight product in the healthcare sectors. At the beginning of our today's webinar, we want to first step back and look at the entire picture of the global smart healthcare market. The global smart healthcare market is growing fast. Common driving forces are like aging population, chronic diseases, and advancing technologies. If we look at the bar chart on your left-hand side, the market is currently at $360 billion US dollars, and is forecast to reach almost 1.5 trillion by 2034. So that's a very strong compound annual growth rate of 17.8%, which indicates that the demand is not only stable but also accelerating. On your right-hand side, if we break it down by regions, we can see that the European market is currently holding the largest market share for smart healthcare, followed by the North America and Asia Pacific. From 2025 to 2034, Asia Pacific is forecast to be the fastest growing market for the smart healthcare. Therefore, for IoT vendors and partners, we believe there will be a lot of opportunities and market potentials to bring IoT solutions for the smart healthcare market on a global basis. The quick development of the smart healthcare also fostered an increasing usage of the Internet of Things. Let's dive deeper to see what are some prevailing smart healthcare related IoT adoptions across different regional markets. For North America, prevailing IoT applications are building retrofits of the healthcare facilities and energy management. We also pay attention to leveraging IoT devices and IoT technologies for patient monitoring and cold chain monitoring of the pharmaceutical product. European smart healthcare market also focused on the smart building retrofits, but we lean more towards the space management. And under the space management, we pay attention to the indoor air quality, building comfort, as well as the fall down detection for patient safety. In Asia Pacific, especially for many well-developed Asian countries and Asian markets, we prioritize the facility management under the smart healthcare building retrofits. We also pay attention to the indoor air quality and fall down detection. Behind these market trends, we see universal needs such as the building energy efficiency, indoor air quality, fall down detection, and cold chain medications. Healthcare has been long and heavily regulated. Well, apart from the market demands, policy initiatives are also driving the smart healthcare service providers to endorse IoT technologies for indoor air quality, ventilation, fall down detection, cold chain monitoring, and building energy efficiency. Those are also sectors where Milesight is committed to bring substantial value and better return on investment. This year, we come up with the Smart Healthcare C.A.R.E. framework to categorize our product not only based on the scenarios, but also what kind of benefits it can help the smart healthcare to achieve. Environmental comfort is about maintaining a healthy and comfortable indoor environment for patients' recovery. And for safety assurance, we offer high precision fall down detection and more LoRaWAN based event triggers. For regulation, we focused on the monitoring of the pharmaceutical product during both the transit and storage. For energy efficiency, healthcare facilities are essentially type of building and requiring the energy efficiency and energy management. With a better idea of what C.A.R.E defines in terms of a smart healthcare, here is a more comprehensive picture of how our product and our product categories could be unified under the smart healthcare C.A.R.E framework. In the following part, we'll tap into each key pillar to elaborate on those product categories with detail. Well, here I want to quickly explain and unfold why environmental comfort is a key pillar. So a healthcare facility, just like nursing home or hospital, isn't just a place where treatment or recovery can naturally happen. Environmental comfort plays a huge role in patients' recovery and employee productivity. Bad air quality and insufficient ventilation will cause higher infection risk as people are gathering and cross-contaminate with each other. Temperature fluctuation can also lead to discomfort and illness. Noise and inappropriate lighting can easily disrupt sleeping and slow down the healing process. Not only for patients, all those above mentioned environmental disruptions and discomfort will also cause fatigue and human errors for medical staff if we are easily distracted and not focused enough. This is when and where we believe Milesight environmental condition monitoring sensors would come in as we are transforming from the left-hand side problem to the right-hand side solution. Environmental comfort starts from the consistent monitoring. In the following part, we'll first look at the sensors for better indoor air quality monitoring. In the daily operations healthcare environment will naturally involve parameters such as TVOC, PM2.5, PM10, formaldehyde, and ozone, which needs to be closely monitored, otherwise they may significantly affect people's wellness if the concentration exceeds the limit. Thereby, we offer a diverse product portfolio, a wide range of indoor air quality sensors to continuously keep track of up to 9 different parameters. And on the top of this, our indoor air quality sensors are LoRaWAN based, support multi-power supply method and wireless deployment to be easily integrated within your current healthcare facilities and systems. And starting this year, all Milesight indoor air quality sensors will support the RED certification, and our AM319 can monitor certain parameters for the healthcare facility owners or the managers to apply work with while to increase your building competitiveness with the internationally recognized certifications. Indoor air quality monitoring is only half a battle. The other is to make timely adjustments, especially in terms of the temperature. And that's where our indoor air quality sensors and our WT smart thermostats will be able to work hand in hand. Temperature has a direct impact on the patient's recovery and many other clinical outcomes, especially for the vulnerable group of people who are already very sensitive to the temperature fluctuation. Our WT smart thermostats can contribute to better thermal comfort, accurate temperature sensing. Our WT smart thermostats are embedded with the temperature sensors. Some of them can also support D2D, device-to-device communication with our indoor air quality sensors, accurate control of temperature based on the accurate temperature sensing. In addition, we offer a diverse product portfolio of different thermostats compatible with different HVAC systems, such as the radiators, PDAC, RTU, fan cool units, and split AC, for example, for global coverage. Overall, our WT smart thermostats are not just devices to turn on or turn off the air conditioning. They are the IoT-empowered approaches for the healthcare operators or the facility managers to timely adjust and better maintain the thermal comfort for the environmental comfort in the healthcare-related scenarios. Managing excessive noise and unbalanced lighting is also crucial for the healthcare environmental comfort. Noise and inappropriate lighting can easily increase people's blood pressure, fasten heart rates, disrupt sleeping, and finally slow down the healing process, patient's recovery. And here we want to introduce, starting from the left-hand side, our WS302. It is a sound level sensor which can monitor and provide accurate noise monitoring. Besides its LoRaWAN-based, it is small-sized and is portable to be easily deployed in the patient ward, in the nurse stations, and many other public spaces of the healthcare facilities. Regarding the light, on your right-hand side is our WF202 motion-based light sensors. It combines the occupation detection with the lighting management, making the lighting adjustment more human-oriented. And this product, based on our previous project, has often been installed at the hallway of the healthcare facilities for more timely lighting adjustment. And by leveraging our IoT-based sensors, lighting and noises are no longer the intangible feelings. They are the manageable conditions that can be accurately monitored, recorded, and adjusted. Restroom is another place hard to be monitored due to the privacy concern. Unfortunately, we are also subjected to many problems such as the harmful gas, unpleasant smell, poor hygiene, cross-infections, and hidden smoking, for example. So starting from the left-hand side is our GS301, which is designated to keep track of the air pollutants such as the hydrogen sulfide and ammonia. Prolonged exposure to the high concentration of those harmful gases can affect people's immune system and increase the infection risk. And apart from the harmful gas, it can also monitor the temperature and humidity. High humid environment will promote the bacterial growth and the higher infection risk. Meanwhile, our GS601 can tackle another big challenge of the undetected smoking or vaping in the healthcare facilities. It helps to prevent the patients and the vulnerable group of people such as the elderly from the secondhand smoke and fire-related accidents. Well, as a comparison to the contaminated environment or the environmental discomfort that may affect people over time, fall down is another high risk and frequently occurred concern in the healthcare that may immediately transform into direct harm. Without reliable monitoring and emergency handling, fall down, bad access, or any other forms of the incident can easily go unnoticed, leading up to more severe consequences. And this will also generate higher pressure and workloads for the medical staff. And we believe that's exactly when Milesight fall down detectors and our LoRaWAN-based smart button and our IoT controllers will be able to intervene. So let's dive deeper to see those products and how they may work together to achieve 1 plus 1 bigger than 2 impacts. In the current fall down monitoring system, privacy and accuracy are two major concerns. Either there is a privacy problem so the product cannot cover places like washroom, or maybe the detection is not accurate enough, causing too many false alarms or unreported events. Milesight VS373 fall down detector is designed to tackle those problems above mentioned. First of all, by the detection technology, it leverages the 4D milliwave radar technology to ensure high precision and 100% anomalous detection. So the product can not only be placed in the ward but also in the washrooms. Besides the single person fall down detection, VS373 can also achieve the fall down detection under the multi-people scenarios. And also it supports the bad presence detection and breathing detection to timely alert the bad access and also the potential abnormal breathing patterns due to the heart attack or stroke, which makes this product very, very applicable in not only hospitals but also the nursing home, long-term care, and rehabilitation centers. In healthcare, many traditional emergency call systems are still relying on the wire buttons. Milesight WS101 LoRaWAN Smart Button provides a wireless option, enabling more flexible and intelligent event trigger. It supports single, double, and long press, so that one button can initialize 3 different actions for 3 different events. On the other side, as you may see from the right-hand side, Our UC300 IoT controller, it can perform up to 1/6 local commands. Don't even to mention its rich industrial interfaces, making it easily and smoothly integrated within your current hospital system to raise local alarms and enable better emergency response and handling. Together, our WS11 and our 300 can work together as a IoT-based emergency response alternative, as you may see from this working mechanism at the bottom. When we talk about regulation, we are talking about the regulation of the pharmaceutical product. There might be many factors which can easily cause the pharmaceutical product to go spoiled. So, for example, if the refrigerating system fails and no one notices, vaccines and the cold chain drugs can easily go spoiled due to the temperature fluctuation out of range. Here, we will provide our Milesight temperature and humidity sensors to better monitor during the transit and storage. If the humid or the water leaks are not well monitored, room temperature or the normal temperature medicine can also lose effectiveness and cannot return to the market. Correspondingly, we offer Milesight water leak detection sensors. And in the healthcare facilities, we're talking about many high value and control drugs. If they are stolen, there might be serious liability. Therefore, a better control access by the Milesight door sensor could also help. Temperature and humidity monitoring is essential and crucial for the healthcare to meet the compliance requirements of the medicine integrated. Hereby, we would like to offer a series of the Milesight temperature and humidity sensors, catering to different detection methods, measurement range, data communication, and preferred application scenarios. Starting from the right and upper corner, TF201 is a cost-effective temperature and humidity sensor. For massive deployment, it can work with a probe and an external optional buffer glass bottle to detect the inside temperature of the target object with less impact of the temperature fluctuation. And the probe is compliant with the EN12830, making it actually applicable for the vaccine temperature monitoring. And this year we have offered another alternative, our TF21TH, with more user-friendly and advanced functions and features such as the external button for customizable reporting. As a comparison to the TF201, if TF301 and 302, they have their own advantages, such as the LCD screen and the optional magnetic door sensor. So why this matter? You may ask. Because for example, our TS302, with the door sensor, the product can be directly attached to the refrigerator, while the probe can be extended inside. So with the screen, medical staff can easily read and check the temperature without opening the door or accessing the platform. Long run and long time cold chain transportation, as you can see from the bottom, from your left hand side, is another place where the temperature can easily shift and the medicine goes spoiled. This year, we plan to offer a new cellular-based temperature humidity sensor. The cellular-based transmission ensures more real-time monitoring during the transportation. Meanwhile, our TX602 probe version is compatible with a wide range of probe and a wide range of the temperature measurement, which meets the temperature monitoring requirement in various occasions such as the thermal box, nutrition tank, or dry ice, for example. After the medicine is well received from the cold chain, we would also recommend the use of EM320TH, which can be directly placed inside the fridge due to its anti-condensing and multi-layer waterproof physical design. Water leak can happen anywhere, not confined to the drugstore, but also the refrigerator and data centers within the healthcare facilities. Where still, once you have one water leak, you may have many water leaks. causing higher insurance fee next year and damages to the high-value pharmaceutical product, electronic medical devices, and even the healthcare facility itself. Therefore, we will be catering to diverse water leak detection sensors that cover different measurement range and different measurement scopes. As you may see from this simulated product deployment scenario, well, they can be deployed to monitor the water leak from a single spot, and that is our EM300 spot water leak detection sensor, our EM300 SLD. And also we can be deployed to measure the water leak from an area, and that will be our EM300 ZLD zone water leak detection sensors. And also with our EM300 MLD, the membrane water leak detectors, the membrane can be attached to measure the water leak from the ceiling, and the membrane can be trained to measure the water leak from some other irregular spaces. Well, in addition to different detection methods, our water leak detection sensors also support the local and remote alarms. They also support the data storage and the data retransformation for better data integrity to early alert and record. Healthcare facilities such as the pharmaceutical stores and hospitals are one of the target application scenarios for the door status monitoring. Hospitals and pharmaceutical stores need door sensors simply because of two reasons. One, there are high value and control drugs. Two, the rising temperature can easily spoil the inventory if the fridge door is not closed properly. Therefore, for better access control, we offer two door sensors to monitor the door open and close status. Both of them are non-intrusive, easy to deploy, so that they can be easily integrated within your current healthcare facility without changing the entire infrastructure. And also we have our EM300, as you may see from the left-hand side. What are some differences? So first of all, the EM300 door sensor can monitor door status as well as the temperature and humidity to timely alarm when the potential room temperature may cause the pharmaceutical product to go spoiled. And also it supports the D2D, device-to-device communication with our UC300 controllers to raise local alarms. As this product has often been placed to the refrigerators, it supports a higher IP rating for better waterproof protection. As a comparison, we also have a WS301 on your right-hand side. It is more small-sized to be easily embedded into your healthcare offices and patient ward. When it comes to the actual deployment, our WS301 door sensor also supports the anti-tamper by alarms, adding one extra layer of the security. Healthcare facilities are essentially a type of building, as we mentioned previously, and they are also energy-intensive building. On the one side, the building systems such as the HVAC and lighting, they're operating all year long. On the other side, the electricity price keeps rising, and the energy consumption has become a heavy expenditure for the hospital and other healthcare facilities. So if a healthcare facility fails to cut the energy consumption and meet the local carbon emissions, they may also face the reduced subsidy rates, bad reputation, and even the negative impact on the overall healthcare rating. Therefore, by more unified HVAC control, smart lighting management, and different levels of the energy monitoring, we aim to help the healthcare service provider to better achieve the energy management while maintaining the building comfort during their retrofit projects. So hospital is energy intensive and HVAC is one of the heavy energy consumer. Previously, we have been introducing our WT Smart thermostat, matching different types of the HVAC system for the temperature adjustment, and we are also very value adding and contributing to the energy saving. So first of all, through the accurate control of the HVAC systems, it can reduce the excessive amount of energy being wasted from overheating or overcooling. And our products like WT41 and WT101, 102, they can work as a product combo for wireless group control to reduce the manual work when it comes to the HVAC adjustment and reduce the potential human errors with better and centralized management of the HVAC systems. Besides, it supports the compatibility with many BMS systems and third-party platforms to ensure that HVAC data can be integrated and visualized through the platforms, so that operators and administrators can see when the valve, for example, is turned on or turned off to estimate the amount of heat being saved. Well, don't even to mention that many advanced functions and features supported by our smart thermostats, such as the local scheduling, children lock, anti-tamper, open window detection, and anti-freeze protection, all transforming into better and competitive advantages of Milesight smart thermostats. So apart from the HVAC, lighting is another cost driver that is often underestimated. So here I want to introduce a list of options for the smart lighting control. Starting from the left-hand side, the product also in the environmental comfort is our WF202, the motion-based lighting sensor, which will enable the occupation-based lighting management, often being placed in the hallway. In the middle, we have our WF156, is our smart panel, which will assist you in managing the light of a region with one panel but one powerful and smart panel. For the lighting management, we are also offer the WF558, the smart light controllers, which will be able to control multiple light circuits for centralized lighting management. And on your very right-hand side is our WF500 light switches. They are LoRaWAN-based smart light switches, supporting the remote and time-based lighting on or lighting off for smart control. And we can also serve as the Milesight D2D agent to control the light circuits. Well, just to be concluded for this slide, Milesight WF light sensors do not just keep the lights on or off. Through the lighting control at different levels, it turns the lighting management into a consistent energy-saving source for the healthcare facilities. Energy waste in the healthcare facilities often comes from two areas. On the one side, the non-critical electronic devices stay powered even when nobody is using it. On the other side, the high-load medical equipment and the heavy industrial equipment causing severe energy consumption without being properly monitored. So if we look at the upper side, with the Milesight smart sockets, healthcare facilities can easily track the energy consumption of the individual electronic devices. And at the panel level, if we move down to the smart current transformer, hospital can also track the energy consumption and the operating pattern of the fan of the HVAC and lighting by using our CT smart current transformers, which offers the high precision and the non-intrusive monitoring of the current. So together, we believe that they will constitute a more complete energy monitoring solution at different levels. Well, other than the smart current transformers, later this year, we plan to introduce our first sub-metering power monitoring hub, which offers full power diagnosis and more comprehensive insights into various power and power-related parameters, such as the current and voltage. Besides, it can handle up to 4,000 amperes, perfectly suitable for the energy monitoring of many heavy industrial equipment such as a water pump, motor, which are widely found in the large-scale indoor environments such as the healthcare facilities. So this project took place in a private hospital located in Singapore. Our client wants an ISO-compliant and wireless temperature monitoring solution that will not interrupt the daily operation. So under this very project, both our EM300TH and our EM500PT100 had been deployed. So with this setup, we assisted the healthcare facility in improving their temperature and humidity tracking, while ensuring that everyday medical workflow will not be affected. Aging population and elderly care centers, they are facing increasing safety challenges associated with fall down. Traditional fall-down systems, they are struggling with too many false alarms or the concern of the privacy violation. Therefore, by deploying the VS373 in a Spanish nursing home, the nursing center benefits from real-time fall-down detection and actual layer of the security. Previously, we have been introducing our WS101 smart button with our UC300 IoT controllers. I have to update the traditional out-of-dated call system. So in this very project in Italy, the WS101 has been deployed at many accessible places, where the UC300 triggers the local alarm for more accurate and responsive emergency handling. Well, Thermobox is often used to transport pharmaceutical products such as vaccine. So under this project, the TX301 is adopted due to its visually appealing LCD screen for data display and high-precision temperature measurement probe, which can be extended inside to measure the inside temperature of the target object, avoiding the impact of the air temperature fluctuations. Here is another health resource center. Our customer require a unified solution to achieve multiple objectives such as the facility management, energy efficiency, and space management across various building and building complexes. This very project demonstrates that how Milesight indoor air quality sensors, HVAC control, water leak detectors could be able to coordinate with each other to maintain the building comfort while reducing the energy consumption. Like many other healthcare facilities, under this very project, the Spanish hospital also faced increasing pressure to boost the building comfort while improving the service efficiency. So by endorsing Milesight LoRaWAN sensors together with our local partner, we transform the lighting control, indoor air quality monitoring, and the emergency response into a more transparent, human-oriented, and IoT-based intelligent system. Well, I have quickly to wrap up. Today we have been going through several Milesight products and product lineups, which are unified under our Smart Healthcare C.A.R.E. framework, catering to better environmental comfort, safety assurance, cold chain medication monitoring, and last but not least, energy efficiency for building retrofits. Well, as we're approaching the end of our today's sharing, we would like to thank and appreciate your involvement and participation. Thank you very much for listening, and here concludes my sharing today.